Another session of Public Health 101. Today we are going to be hearing from Nancy Sutton, and she's going to be talking about the Center for Chronic Care and Disease Management. So Nancy, if you'd like to introduce yourself and get going.
All right, great. So good morning, everybody. My name is Nancy Sutton, and I am the Center Chief for the Center for Chronic Care and Disease Management. And I'll go over each one of the components and programs within the center in a minute. I'm just going to bring up my slides. You can bear with me for one moment. And while I'm bringing these up, I do want to say, please, it's a small group, and please interrupt me, raise your hand if you have any questions along the way. I'm happy to stop and chat if needed. So again, I'm going to be going over the components of the Center for Chronic Care and Disease Management. And we sit within the Division of Community Health and Equity. And I'm making the assumption that most everybody on the call, if you've been on other sessions earlier in the summer, have seen this already, but just in case. So within our division, we have the Community and Family Health, which is basically an office of maternal and child health. And Deb Garneau oversees that, and I should go back, and Christine Campagna oversees the entire division with Deb as her deputy. We have 4 additional centers, and in these centers, well, I'm going to start with Center for Health Promotion. I think Tara Cooper has recently presented, and she has 3 programs under her. And some of the bigger programs, the drug overdose prevention, which you're probably familiar with and have seen a lot in the news. We have tobacco control under there, as well as violence and injury prevention. And we have a Center for Perinatal and Early Childhood Health. These are also really big programs on family visiting, first connections, newborn screening, which some may be familiar with already. And we also have a pediatric mental health access program and a very large program, WIC, which serves mothers and infants and children on nutritional needs based on income eligibility. And that's been around for a very long time, big program. And we have a Center for Preventive Services. Trish Washburn oversees that program, that center. And the biggest program in there, which I think everybody is aware of, is an immunization program. And so all of the COVID vaccines, right now they're very busy with monkeypox and the typical immunizations and vaccines that children and adults get fall under that program. Again, pretty big program, but also focusing on adolescent and school and reproductive health. The asthma program sits under Trish, and an oral health program with Sadie leading the charge on that. So I'm going to focus on our center for Center for Chronic Care and Disease Management. And before I do, let's see, I'm just going to open this up again so I can see everybody. So my apologies, I can't see everybody, but I thought since there's a small group, I think it would be helpful if everyone introduced themselves and where you're coming from. And so that might be helpful, and I can maybe fine tune what I focus on. I see Justin's on the call. Justin, did you want to start?
Sure. Morning, Nancy.
Good morning.
I'm Justin Baker. I work as an evaluator and epi in the Diabetes, Heart Disease, and Stroke program.
Oh, thank you. Good morning. And John Carroll?
Hello. So I'm an intern working in the Adolescent School and Reproductive Health program, and today's actually my last day before I go back to school. So
nice.
I've been working on some data entry and also some other projects, such as for the Youth Health Ambassadors program.
Fun. Great. Well, I hope you enjoyed your time, and we thank you for all your work during the summer. Thank you.
Of course. Thank you very much.
And Judith Hahn?
Hi, I am Judith Hahn. I am a contractor in the Center for Emergency Preparedness and Response.
Excellent. Well, good morning, everybody. So I'm just going to put that back down. And thank you for that. It's always good to know who everybody is, especially when we have such a small group. So in our center, I'll start here, we have 8 different programs: Alzheimer's, chronic disease self-management, which is basically an arthritis program. We have women's cancer screening program, comprehensive cancer program, diabetes, heart disease, and stroke. We also have a cancer registry, colorectal cancer screening, and a wise woman program, but I'll go over each one of these and what they entail. This is a little bit fuzzy, my apologies, but it gives you the, how it's all laid out for the entire center. I have 5 direct reports here across the top. So Victoria Parker oversees the Alzheimer's program. We have Megan Fallon, who oversees the diabetes, heart disease, and stroke program. And we have Jasmine, who oversees arthritis, chronic disease self-management. And we have Eric Lammy with the women's cancer screening program, and C. Kelly Smith with comprehensive cancer. And I won't go over, what everybody in here, because that would take another hour probably. But you can look at this, and I think we can provide copies of the PowerPoint as well, which is easy enough to do. You can see the diabetes, heart disease, and stroke program is, I'd have to say, probably the biggest program, alongside the women's cancer screening as well. So we will move on from there. So amongst all of these 8 programs that we have, we are predominantly federally funded. So we depend greatly on basically CDC funding. We do not have grants per se, but they are cooperative agreements. And we also get a little bit of money from the state for the cancer registry in the women's cancer screening program, but it's a really small amount, relatively speaking. And here I have a whole list. Oops, sorry. Back. Here we go. So over here we have a whole list of required skills. So anybody overseeing these programs, it really takes a team. It takes an entire team within the program, and even the program within the center, within the division, and really within the department. So we depend a lot on fiscal management services. We tap into our communications department, our IT, so on and so forth, our Center for Health Data and Analysis. But within that team, contract management, project management, program management skills, super important. Staff management, of course, grant writing in this center. Really, I just can't even express to anybody going into public health the importance of grant writing and report writing. Data collection, analysis, interpretation, dissemination, and as you will see, with all our programs, it's really the foundation of public health. That is a big component of what we do as well. And of course, we want to let everybody know what our outcomes are. How are we doing? How's it working? What are the successes? And so other people can learn from it, and success breeds success. So we really want to be able to communicate those. And again, communication with funders, partners, and key stakeholders. And we do a lot of presentations locally throughout the state and at national meetings. Megan Fallon from the Diabetes, Heart Disease, and Stroke Program and myself will be presenting in Chicago next week. I will be focusing on the work that we're doing with community health workers through the chronic disease programs. And Megan will be talking about data collection from federally qualified health centers on a project that they work on, which is always good to share at the national level. So in our center, I think a lot of people are like, oh, chronic diseases, you must focus on physical activity, nutrition, and a lot of prevention stuff, and school lunches, and making sure children are, exercising. But that really sits under the Center for Health Promotion, to be honest with you, with the tobacco program. In the Chronic Care and Disease Management Center, with our funding is for adult care only. And that is our focus. Our funding tends to be extremely prescriptive. And so we focus more on secondary prevention and being sure that chronic diseases are diagnosed early and that they're well managed and in good control. So I'm going to go through each one of those. Does anybody have any questions at this point? So I will go through each one and just kind of give it really high level overview of what each of the programs do. And so we have here with the Alzheimer's disease and related disorders program, we have funding from the CDC. It is new. It is a brand new program in public health. And that's super exciting because that doesn't happen every day. And so we applied for that funding, and I think it was, we submitted the application in May of 2020, and we were one of few states that did receive the highest level of funding. And it's a 3-year funding cycle, and we will be applying for a competitive grant coming up December and into the spring. So we'll see how that goes. I'm confident we have positioned ourselves well, but it's really exciting to get a brand new program off the ground. And Victoria has put this slide together for me as the development of that program from scratch, from the ground up. It really took a lot of collaboration with key stakeholders. There is a lot going on with dementia and Alzheimer's in the state of Rhode Island. But as a state department, in our role is really start connecting those dots and being sure we're leveraging all of the resources in order to have the biggest impact. So we align very closely with the Alzheimer's Disease and Related Disorders Advisory Council. That's a council that's in statute as of a bill that was passed in 2019. And I am the council chair of the advisory council. And they completed a state plan back in 2019, and we follow that closely. So those were, and of course, the surveillance system. So we have a lot of great data sources, and we have an epidemiologist from Brown who's pulling that all together and doing a pretty in-depth dive of all the data to be able to tell the story. So 3 key areas, overview, health systems. So Victoria has a group from the Alzheimer's Association, council members and others who are working with healthcare facilities on the development of operational plans for patients that they see who have cognitive decline and or dementia and Alzheimer's. As well as we just convened for the first time the Quality Improvement Collaborative, and this is working on health systems transformation as it pertains to geriatrics and cognitive decline in Alzheimer's. We work very closely with Rhode Island College and others in the Alzheimer's Association on providing, and also Rhode Island Geriatric Center on providing education to the healthcare workforce. And the Rhode Island College is in the midst of developing a 45-hour certificate program for providers that focuses on what we call ADRD, but Alzheimer's disease and related disorders. And you will see that there are a lot of acronyms in here. So, and I put them in there because that way, if you hear it again, maybe you'll remember what they mean. There's so many of them at the department and in public health. So we have community-based efforts, a brain health campaign that's being developed, and working with communities. Specifically, we work with Cranston, but Providence and Newport and other cities also have interest in working with community-based organizations, businesses, frontline first responders on addressing their community members who have dementia and or Alzheimer's. And we also offer workshops through the Community Health Network, which I will get to in a second what that is. So here we have, and again, please, I can't see any hands raised, so my apologies. So you can just shout out if you have any questions or want to add any comments. So with the Diabetes, Heart Disease, and Stroke program, we focus on hypertension, high blood cholesterol, prediabetes, and diabetes. Again, it's not really the primary prevention of all of that. It's really the secondary prevention and being sure people with these chronic diseases are able to control their condition. It has 6 main components. Again, epidemiology, surveillance, evaluation. The data is extremely important in what we do. We work with health systems interventions, diabetes prevention program, and we also have a diabetes self-management education and support services, which are provided by certified diabetes outpatient educators. And again, here we have the community health network, which we'll get into. I can click on that. You can take a look at it. I think it pop up. So it's operationalized by the Round Parent Information Network, and people can sign up for all kinds of classes. This is funded by the Diabetes, Heart Disease, and Stroke program and utilized by many of the programs within the center. Here you see diabetes prevention program, chronic pain self-management, arthritis program oversees that. Here are certified diabetes outpatient educators. There are Know the Early Signs, that's Alzheimer's program. So there's all kinds of powerful tools for caregiver, which is extremely important for all kinds of issues, but including for caregivers of family members or close friends with Alzheimer's. Tools for Healthy Living is a chronic disease self-management program. Here's another Alzheimer's, and we have Walk with Ease. So people can sign up for these classes online through Ripen. Oh, there we go. All right. So again, what do we do in the health system? And this is a super high level. There's a lot of detail in each one of these bullets, but just to give you a sense of what a program does with chronic disease and public health, with our CDC funding, we have a program or initiative called Care Community Equity, and that includes 5 different federally qualified health centers and 2 free clinics that we work on to improve the care for patients with diabetes, prediabetes, as well as cardiovascular disease. And we also work a lot with Rhode Island Medicaid in the Executive Office of Health and Human Services, as well as Randy Belhumer here in the department, and Deb Garneau, who oversee the work of community health workers as far as it pertains to public health. We have a specialty certification that was developed right before COVID, and but it's starting to pick up steam. So we have about, I think, 36 people with that CVD diabetes specialty certification. And we have also worked very closely with Medicaid in providing support for the establishment of the Medicaid coverage that just got approved by CMS, the Centers for Medicare and Medicaid, in June of 2022. So that just got done, which was fantastic. All right. And the diabetes prevention program. So diabetes prevention program is really, I'd like to call it like a secondary prevention if I could. And so it's really with people with prediabetes or the risk of developing diabetes. So a high BMI, body mass index of over 24, or having glucose being high, not so much diabetes, but not in a healthy range either. So it really puts people at risk of developing diabetes. So we want to catch it before it gets there. It is a year-long program. It's actually covered by Medicare. We work closely with the National Association of Chronic Disease Directors and CDC on sustaining it through coverage here in Rhode Island. So more to come on that. And we do have a statewide focus on health equity zones. And when you get these slides, you can click on any of these, BMIs here, health equity zones, but I'm sure you guys have learned about health equity zones already. There we go. So here's the Community Health Network. So again, dealing with Alzheimer's, CDOs, chronic disease self-management, chronic pain self-management, very popular. This one here is really popular. Diabetes prevention and management programs. There's fall prevention in there, caregiver program, and tobacco cessation services. So we'll jump into the arthritis program, also known as the Chronic Disease Self-Management Education Program. Tools for Healthy Living is the name that is given to the program, which is basically chronic disease self-management. So if a person has heart disease, cancer, any type of any type of chronic disease and how to navigate the system and really controlling and helping self-management of the disease. And that's what they focus on. We have Walk with Ease. The Walk with Ease program is really designed for people who have arthritis, who do not exercise but really anybody can go to it. And it's a great program for people who really physical activity isn't really part of their day, their lifestyle, but they see the need and really want to start being more physically active. So it's an excellent program for people who just want to get out there and start walking. And walking, as we all know, is excellent. So it again offers through the Community Health Network, and our leaders of these programs who oversee these workshops, who really encourage, and this is true of DPP, for leaders to become community health workers as well. So the cancer programs, we have 4 cancer programs. I will go over each one. We have the Cancer Registry, the Comprehensive Cancer Control Program, Women's Cancer Screening, and Colorectal Cancer Screening. So we'll start with the Cancer Registry. It is a very large database. It has over 415,000, I believe it is. I'm almost positive that's the number. Records in there of people over the years. It has been in place since, I believe I want to say it's 1998, but it's been in place for a very, very long time. It is operationalized at the Hospital Association of Rhode Island, and it is a registry of most cancers diagnosed among residents from Rhode Island. And the registries, the local registries, exist at all of the Rhode Island hospitals and some of the labs, and they are by state law required to submit that information into our cancer registry. And we do receive out-of-state diagnosis of Rhode Island residents. So we have a cooperative agreement with other states. And so if somebody here, say somebody from Massachusetts is diagnosed in Rhode Island, we're able to share that with their cancer registry and vice versa. It serves a really important role on epidemiology and surveillance of cancer in the state of Rhode Island. And there is an excellent data page on cancer. Let's see if this opens up. So all of this data here, it comes from our cancer registry. I'm not going to go through each one, but they are, so in incidence by 6 and 8. So if we click on that, work. Sure, why? So Junhee Oh, who is now in the Center for Health Data and Analysis, created this with, I think it was Jay Metzger, helped her out with this, and this is just outstanding work. So it's really nice, interactive. You can change the years, change it. You can change the age ranges. You can just look at male. You can just look at female, and so on and so forth. So if you ever need any cancer data, excellent resource there. And we have the Comprehensive Control Program, Comprehensive Cancer Control Program. Again, using evidence-based strategies. They just finished up a strategic plan with the Partnership to Reduce Cancer in Rhode Island, which is a coalition funded by CDC through the Department of Health, and focusing on prevention and early detection, basically screening work. And C. Kelly Smith, who is the program manager of this, works very closely with Eric Lammy and Matt Boudreau with the colorectal and breast and cervical cancer programs. And she also focuses on lung cancer as well. She works a lot with partners out in the community on survivorship and palliative care. And leadership of a lot of the work that's done regarding these issues is done through the Partnership to Reduce Cancer in Rhode Island. It is a really large coalition of very passionate people who work in these areas. Another area is skin cancer, and I'm sure most of you have seen the skin check that's offered at the state beaches and some other parks throughout the state. There's one in Roger Williams Park here coming up, I think tomorrow, yeah, August 26th. And I think that must be the last one. And so they have Brown Dermatology works closely with the Partnership to Reduce Cancer, the Department of Health, Lifespan, DEM, and we go out and we do free skin cancer screenings. Has been very effective. I don't know the number of suspected melanomas that were diagnosed. I don't have the final figure on that, but it was a fair number in the state of Rhode Island each summer. We took a break on this last summer and the summer before because of the pandemic, but this has been going on for quite a few years. It's excellent service. So we have the Women's Cancer Screening Program, which is breast and cervical cancer screening. This program has been around for a very long time, since the 1990s. It provides free breast and cervical cancer screenings to uninsured and underinsured women and who are income eligible. And we work very closely with the federally qualified health centers to support patient navigators. So we support patient navigators, which is a type of community health worker within federally qualified health centers to work with as part of their care team to increase screening rates and follow up to screenings regardless of insurance. And we have screened over 40,000 women for breast and cervical cancer since 1995. The colorectal cancer program is similar to the breast and cervical cancer program. The difference is, and it's a big difference, is that with colorectal, we do not and cannot pay for, we do not have the funds and we cannot use our funds to have a wide range of direct service. With the Women's Cancer Screening Program, we actually can pay for the screening. If a woman, for breast and cervical cancer screening, which I probably should have said, if a woman who is uninsured is diagnosed or with a suspicious, positive or diagnosed, we pay for that follow-up screening and we get her, and if she has breast cancer or cervical cancer, we get her on Rhode Island Medicaid. So she's covered moving forward. So that's a really big, important piece of that program. Whereas the colorectal cancer program, again, working with patient navigators, and we're able to support the patient navigators within the federally qualified health centers to increase screening rates and provide follow-up to the screenings regardless of insurance. We're not able to pay for the actual screening itself. So they're a little bit different. And lastly, we have the Wise Woman program. In the Wise Woman program, that's Adelaide Lafferty-Ritt, and she works with the Rhode Island Free Clinic and Clinica Esperanza, the two free clinics in the state of Rhode Island here in Providence. And they offer cardiovascular disease and diabetes screening for women who participate in the Women's Cancer Screening Program within these two clinics. The nice thing about this program is that we are able to offer free community resources for people to increase their physical activity, as well as for chronic disease management. For instance, one-on-one with a certified diabetes outpatient educator, unlimited visits she can pay for, Weight Watchers memberships, and there's a few other things that probably are not listed here, but she's got a whole list of stuff that are available to patients. It's an excellent program. And I think that's it. Any questions? I agree today.
I know. Thank you so much. This was a great presentation, very informative, and there's so much great work happening in just this one center. It's crazy.
Yeah, there's a lot going on, and this is just really the tip of the iceberg in a high level, because I would be talking for another 2 hours. I don't think anybody wants that.
I believe it. I believe it.
It's all good. All righty. Well, if anybody has any questions, please do feel free to get in touch with me, and I will send over the PowerPoint to Jennifer so she can send that out, or maybe it'll be recorded and you can take a look at it at a later time.
Great. Thank you.
Okay, great. Thank you. Bye-bye.